Good morning everyone. We are the group 5 and today we will be discussing to you about the different types of fracture. These are the contents that our presentation have. First is the fracture and the different types of bone fracture. I am John Paul Timachas and I'll be discussing to you the fracture and the different type of bone fracture together with my group mates. So when you heard the word fracture, what comes first into your mind, or do you have any insight about the word fracture? A fracture is a break or disruption in the continuity of bone, or it is a disruption of the normal architecture of the bone. So this basically means na ang fracture is yung pagkasira, pagkaputol, or even yung crack sa ating bones. And this commonly happens due to accidents like car accidents, pagkahulog, injuries sa mga activities like sports. Other causes are low bone density, or ang mas malala is osteoporosis, where it causes a hole sa loob ng ating bones at ang pagnipis ng outer wall ng ating buto. These are the different type of bone fracture. We have the open fracture, closed fracture, partial fracture, complete fracture, stable, displaced, comminuted fracture, compression, green stick, impacted fracture, fissure, oblique, close and pads fracture, transverse, spiral, avulsion fracture, segmental, stress and longitudinal fracture. So we can see in the picture the normal bone structure kung saan wala pa itong fracture or broken bone. The first one is the open fracture, a fracture that is associated with an open wound or broken bones protrudes through skin. So ang meaning ng open fracture is yung break sa bone na exposed sa external environment, which is the outer layer of the skin that has wound. So we can see in the picture na yung fracture ay exposed siya sa isang wound or sa outer layer ng ating skin. The second one is the closed fracture, a simple fracture that with no open wounds. Ang closed fracture naman is yung broken bone pero yung skin is intact or hindi siya exposed sa ating outer layer ng skin or sa isang wound. So we can see in the picture na yung fracture is nasa loob lamang at hindi siya exposed sa outer layer ng ating skin or sa isang wound. The next one is the longitudinal fracture. A fracture extends along the length of the bone. So ang longitudinal fracture naman is yung fracture line niya is pa longitudinal axis at yung fracture is passing through to the center. So we can see in the picture na yung crack niya is pa longitudinal axis at nagcross ito through the center.
Good day everyone, I'm Melissa B. Pagkarangan and I'll be discussing about partial and complete fracture. Partial fracture is also known as incomplete fracture when a bone cracks but does not break all the way through. Partial fracture can sometimes be less severe than complete fracture, but they still need a proper medical attention. They can occur in any bone. Batay po sa image na inyong nakikita, ang partial fracture ay isang uri ng pagkabali ng buto na kung saan ay nangyayari kapag nagkakaroon ng bitak ang buto, ngunit hindi ito tuluyang nabali. Madalas itong makita sa mga bata na mas malambot at flexible. Complete fracture. Complete fracture, this is a fracture in which the bone is completely broken into separate pieces, or a bone breaks where the bone has broken all the way through into two or more pieces. Complete fracture o buong pagkabali ng buto ay nangyayari kapag nabali ng lubusan ang buto sa dalawang bahagi o higit pa.
I'm Rika May Princena and I will be discussing the one of the types of fracture. So first is stable fracture. Stable fracture, the broken ends of the bone line up and have not moved out of place. Stable fracture, a bone that is broken but with minimal damage. At kung minsan ay humahantong sila sa mga pinsala tulad ng mga broken bones o sirang buto. Hindi lamang masakit ang mga bali kundi nagdudulot din ito ng iba pang mga issue. Next is displaced fracture. There is a gap between the broken ends of the bone. Repairing a displaced fracture may require surgery. In a displaced fracture naman, the bone is snapped into two or more parts and moved so that the two ends are not lined up straight. Ang mga bali ay kadalasang sanhi ng mga trauma tulad ng pagkahulog, aksidente sa sasakyan o pinsala sa sport.
Good day everyone. I am Bill Clifford Reynoso and I am here to present to you the comminuted fracture and the compression fracture. Comminuted fracture is a fracture in the bone in which the bone is splintered or crushed. A comminuted fracture is a type of bone fracture characterized by shattering or breaking of a bone into multiple fragments. In this type of fracture, the bone is broken down into 3 or more pieces, which can result in a more complex and challenging injury to treat. This type of fracture often occurs due to high-impact injuries such as severe car accidents or falls from significant heights. This type of fracture are considered severe and may require surgical intervention to realign and stabilize the bone fragments. Treatment options can include the use of pins, plates, or screws to hold the broken pieces together. The recovery from this fracture can take a long time and may involve physical therapy to regain strength and mobility in the affected area. The next one is the compression fracture, a fracture that's caused by a force from both ends. A compression fracture is a specific type of bone fracture that occurs when a bone, typically one of the vertebrae in the spine, collapses or becomes compressed due to a compressive force applied to it. Compression fractures often affect the vertebrae, which are the bones that make up the spinal column. They can occur in any region of the spine such as the cervical, thoracic, or the lumbar spine. The treatment of compression fractures depends on the severity of the fracture, the underlying cause, and the individual's overall health. Treatment options may include pain management, rest, bracing or wearing a back brace to support the spine, physical therapy, and in more severe cases, surgical procedures to stabilize the spine.
Good day everyone, I'm Angelica Wandasan who will be discussing the green stick fracture and impacted fracture. Green stick fracture. One side of the bone is broken and the other side is bent. A green stick fracture is a type of bone fracture that occurs in children. Karaniwan itong nangyayari sa mga bata dahil mas flexible ang kanilang buto compared to adults. It's called green stick because it's similar to trying to break a green flexible stick. It may splinter and bend but it doesn't completely snap. As you can see at the picture, the green stick fracture ay isang uri ng kasiraan sa buto na kung saan ang buto ay nabali o may punit, ngunit hindi ito nagkakahiwalay ng lubusan tulad ng isang sakong o kabuuang pagkabali. Ang mga braso at mga paa ay ang pangkaraniwang lokasyon kung saan ito makikita. Next, impacted fracture. An impacted fracture occurs when a bone is broken and the broken ends are driven into each other. This can happen when a great amount of force is applied to the bone, causing it to compress. So, ang impacted fracture ay nangyayari kapag ang isang buto ay nabali at ang mga dulo ng nabali na bahagi ay tinutulak pabalik sa isa't isa. Maaaring mangyari ito kapag may malaking persa na nilalapat sa buto na nagdudulot ng pagkakadikit ng mga dulo nito. Tinatawag itong impacted dahil ang nabali na dulo ng buto ay tinutulak inimpit pabalik sa isa't isa. Madalas itong makikita sa mga buto na malapit sa kasukasuan o joint area tulad ng balakang o tuhod.
Good day everyone, I am Angeline Ramos and I will be discussing to you the oblique and fissure fracture.
Oblique fracture. It is the break occurs at the angle across the bone. Usually, one fragment is slipped by the other. So, from the word oblique fracture. Oblique. So, pa-slanting yung direction or yung position ng nag-crack na bone or yung na-displace na bone. So, fissure fracture, it is the crack true bone without alteration in its ligament. So, without alteration, walang pagbabago. Unlike sa ibang bones na pag may matinding crack, talagang naghihiwalay yung mga bones sa isa't isa. So, as you can see on the picture, konti lang yung crack ng bones at hindi sila naghiwalay.
Good day everyone, my name is Rog Ochinang who will be discussing the spiral fracture and transverse fracture. Spiral fracture. Fracture in a spinal or S shape, usually caused by twisting injury. So sabi nga dito, it usually happens when the bone is twisted due to an injury. So example po natin dito is like yung basang towel po, tapos kung paano mo siya i-twist. That's the example of how this type of fracture can occur po. Imagine mo na lang yung itsura nun pag twist mo yung towel na basa. Ganun po ang itsura ng spiral fracture. So, next is transverse fracture. So, transverse fracture is a break at right angle to the long axis of the bone. So, a transverse fracture is a straight break that goes across the bone. So, this fracture often happen when a bone is hit directly from the side. So, nangyayari itong fracture na ito pag nahihit yung bone natin directly from the side po. So, for example, it's like breaking a stick in half by creating two separate pieces. So, pag hinati mo yung stick in half, di ba mag-a-across yun? So, ganun po ang itsura ng fracture. So, that's the example of how this type of fracture can occur. So, this is a type of transverse fracture.
Good day everyone, I'm Alyssa Marie De Martin. So today, I will be discussing to you the avulsion fracture and Cole's fracture. Avulsion fracture, bone fragment is pulled away from its main body by soft tissue attached to it. So, as you can see in the picture, if piece of bone is pulled apart along with the tendon and ligament, we called it avulsion fracture. Avulsion fractures are most common in sports like football, gymnastics, and other sports that involve sudden changes in direction. Cole's fracture, a fracture of the distal end of the radius with backward displacement of the hand or type of broken wrist. As you can see in the picture, the wrist is broken, and it usually occurs after a fall on an outstretched hand.
So, good day everyone. I am Princess Sally Bulandato and I will be continue the report about types of fracture. So, I will be discussing the three types of fracture, which is patch fracture, stress fracture, and segmental fracture. So, we will be starting at patch fracture. So, patch fracture, a fracture of the distal end of the fibula with an injury to the tibial joint. It is type of a broken ankle involving either of the bony parts of the ankle called malleolus. So, when we say patch fractures, it is located in our ankle or joint. So, yung injury na ito, it is caused by a combined abduction, external rotation from an eversion force. So, para mas maintindihan nyo, para mas maintindihan nyo, naglagay ako dito ng example, which is, an example of patch fractures would be in a sports tackling injury. So, ang sports tackling injury, example niya is, the player receives a blow to the outside of the ankle, causing the ankle to roll inwards. So, yun po yung example ng patch fracture. So, yung common causes po ng patch fracture are traumatic injuries such as falls, sports-related accidents, or motor vehicle accidents. When the ankle joint is forced into an extreme position beyond its normal range of motion. That's what we call patch fracture. So next, let's move on to stress fracture. So ano naman po yung stress fracture? So, yung stress fractures are tiny cracks in our bone. Yung mga maliliit na cracks sa ating mga buto. They are caused by repetitive force, often overuse. So, madali lang po siyang intindihin. Stress fracture daw ay nagkukos siya by repetitive force, often overuse. Yung mga na-overuse na activity na ginagawa natin and overuse in our bones. They happen when a physical activity puts too much pressure. So, ito na nga yung sinasabi ko. Yung activity na ginagawa natin puts too much pressure on a bone and it doesn't have enough time to recover. So, pag nagkaroon ka ng stress fracture, wala kang enough time para makarecover. So, nag-i-start siya as a bone bruises that eventually become small cracks in the bone's surface. Yung common causes naman ng stress fractures includes playing a sport and repetitive motion you do for your job. So, pag nagsisimula siya sa small lang na bruises, pag inulit-ulit mo yung activity, it can cause stress fracture kasi mas nagiging malala siya. So, yung tatandaan lang po natin sa stress fracture is any repetitive motion or activity that puts pressure on your bones can cause a stress fracture. So last, so here we are in our last types of fracture, which is segmental fracture. So, yung segmental fracture naman is the bone is broken in at least 2 places. Na-broke siya into 2 places, leaving a segment of your bone totally separated by breaks. This fracture can affect any long bone in your body. Itong segmental fracture na to, naaapektuhan niya yung mga long bones in our body. This fracture pattern is frequently associated with high energy mechanism and devascularization of a segmental fracture fragments, meaning these injuries daw are associated with increased morbidity and long-term complications, mahabang komplikasyon, such as delayed union, non-union, and or infection. Nag-cause din siya ng infection sa ating bones. So, ang segmental fracture naman is, ang tatandaan lang po natin dito, when we say segmental fractures are fractures that occur in 2 or more places along with the same bone. This can occur when a bone is subjected to a high level of stress or strain. Yun lang po yung tatandaan natin when we say segmental fracture. So, that's all po sa aming reporting about types of fractures. I hope you learn in our reporting. Thank you!